Hello, welcome to the Osteoporosis Presentation. My name is Pamela Kirkevich, and I am the Senior Health Promotion Specialist at SummaCare, and I will be your host. During this presentation, I will define osteoporosis, review statistics, common symptoms, and risk factors. I will also review the screening tool and identify treatment options and practices to improve well-being. Here are the 8 dimensions of wellness. While all dimensions of wellness need our attention, there doesn't have to be balance among all dimensions at a given time. Instead, the goal is to find harmony with the dimensions that are most authentic to you in the moment. This presentation will focus on the physical domain by adopting healthy habits and avoiding or minimizing risky behaviors that are hazardous to our well-being. The bony skeleton is an active, vital organ. It has 2 primary functions, structure and storage. Structurally, bones protect your other organs. They create a framework for muscles and tendons that allow you to move. As a storehouse, bones stockpile essential minerals that are available when needed. One of the main minerals, calcium, is found in our bloodstream and helps the heart to beat, muscles to contract, and nerves to conduct impulses. If the blood calcium level is low, the signal goes out and calcium is taken from your bones. This doesn't cause any harm if it happens once in a while. However, too many withdrawals of calcium can be harmful to our bones. Defined, osteoporosis is a bone condition that occurs when the body loses too much bone, makes too little bone, or both. This causes the bones to become weak, and they may break from a fall, sneezing, or minor bumps. There was a time when people thought osteoporosis was something that happened to everybody when they got old. Fragile bones and a humped back were inevitable. We now know this is not true. Some people are more likely to develop osteoporosis due to risk factors for developing weak and easily broken bones. Understanding your risks will help you and your healthcare provider take steps to ensure strong and healthy bones for a lifetime. Osteoporosis means porous bone. Viewed under a microscope, healthy bone looks like a honeycomb. When osteoporosis develops, the holes and spaces in the honeycomb are much larger. Osteoporotic bones have lost density or mass. As bones become less dense or hollow, they weaken and are more likely to break. Here are a few statistics and facts. Osteoporosis is often called a silent disease because one can't feel bones weakening. Breaking a bone is often the first sign of osteoporosis, or a patient may notice that he or she is getting shorter or their upper back is curving forward. Females lose up to 20% of their bone density in the 5 to 7 years after menopause. About 54 million Americans have osteoporosis and low bone mass. Studies suggest that approximately 1 in 2 females and up to 1 in 4 males age 50 and older will break a bone due to osteoporosis. People with osteoporosis most often break a bone in the hip, spine, or wrist. Osteoporosis is responsible for 2 million broken bones and $19 billion in related costs every year. However, in 2025, experts are predicting that osteoporosis will be responsible for approximately 3 million fractures, equating to $25.3 billion in costs annually. And last, if your mother or father broke a bone as an adult, you may be at risk for osteoporosis. Let's review some warning signs that you may have osteoporosis. Or hunched or slouched posture, brittle bones that break easy or from minimal force, loss of height, either from the loss of bone or slouched posture, which may be due to stress fractures. Stress fractures are very thin cracks in bones that can occur when the bones are weak and suffer from minimum traumas like falling down or bumping into hard surfaces. And last, back pain caused from easily fractured vertebrae and the curving and weakening of the spine. These symptoms may creep up on you, so it's important you take easily fractured bones and a change in posture and height seriously. While we can't change the basic biological facts of our lives that are strongly linked to developing weak bones and potentially osteoporosis, knowing your risk factors makes it possible to take effective action to protect your bones. Older age. People can get osteoporosis at any age, but it is rare under the age of 50. After middle age, our bones do gradually lose stored reserves of the minerals that make them strong. How fast a person loses bone minerals depends on their health and many other factors. Some people start out with more bone mineral and lose it more slowly, while the breaking point can come quickly for people who start out with bad health, weak bones, and/or unhealthy eating habits. Female gender. Females are twice as likely to get osteoporosis as males. About half of females and 1/4 of males over age of 50 will break a bone in their remaining lifetime. Menopause. In females, the sex hormone estrogen protects bones through adolescence and young adulthood. When estrogen drops off sharply at menopause, bone mineral loss speeds up and bones become brittle and more prone to breaking. Family history. Like many things, the osteoporosis condition runs in families. If either of your parents broke a bone as an adult, your risk is higher. Sometimes people don't even realize they have had a fracture. This is especially true for the vertebrae or the bones of your spine. Vertebrae can break or fracture without any symptoms at all. Noticeable height loss and forward bending of the spine may be the first signs that fractures may have occurred. Body type and structure. Small and thin people tend to break more bones. Many things contribute to this: poor nutrition, low muscle mass, low circulating estrogen, and less fat padding to cushion a fall. If you have very low body weight, your bones don't have to work very hard to carry you around. Fortunately, building up muscle through exercise and weight training is proven to help thin, small-boned people improve their bone strength. And last, broken bones and height loss. People who break a bone as an adult may already have osteoporosis and not know it. Some broken bones are obvious and some are hard to detect. Vertebral fractures in your spine can be painless, and the risk of death goes up 15% in the 6 months following a vertebral fracture. These fractures may not be discovered until a person has developed an extreme curvature of the spine. While some risk factors cannot be changed, many other risk factors for weak bones are within your control. Not getting enough calcium and vitamin D. Most people can get the calcium they need from foods like cheese, yogurt, leafy greens, and fortified cereals. Calcium supplements are good for filling in when you can't get enough in your diet, but it's always better to get your calcium from food. Calcium by itself is not enough. You also need enough vitamin D to help your body absorb calcium from the foods you eat. It can be hard to get all the vitamin D you need. Vitamin D is naturally made by a reaction in your skin to sunlight. Many people get too little sun or have skin that doesn't absorb much vitamin D. Because there aren't many food sources of vitamin D, supplements may be recommended. Not eating enough fruits and vegetables. We all need to eat fruits and vegetables to have healthy bones. Magnesium, potassium, and vitamin K contribute to building and maintaining a strong skeleton. Most experts believe that people can usually get what they need from a balanced diet rich in fruits and vegetables. Multivitamin mineral supplements are recommended for individuals who have restricted diets, unhealthy eating habits, or digestive problems that interfere with nutrient absorption. Not getting enough exercise or physical activity. Remember, bone is a living organ in a constant process of tearing down and building up. It relies on the push of gravity and the pull of muscle to maintain its strength. Without enough physical activity, bone mineral density and muscle mass are lost at a very fast rate. This is particularly true for people over the age of 50. The right kind of exercises can help you avoid this. For example, you can do fast walking for weight bearing and lifting weights for muscle strengthening. Drinking too much alcohol. Heavy drinking makes bones weaker and easier to break. By heavy drinking, we mean more than 2 alcoholic beverages a day for females and 3 a day for males. Long term, it doubles risk for hip fractures in older males. Dieting too much. Super rapid weight reduction causes bone loss by unloading the skeleton. Bad diets that scrimp on nutrients can pull essential minerals from bones, leaving them weak and more likely to break. Safe dieting should be slow and steady. Weight loss done right can actually improve bone strength without weight-bearing and resistance exercise, a healthy diet, and plenty of calcium and vitamin D. Smoking at all. Last but not least, most people do not realize that smoking causes skeletal damage and increases the chances they will break a bone. Taking care of your bones is one of the many reasons to stop smoking. Broken bones can be disabling, affecting a person's mobility and independence. Think of it this way. It may make it easier to stick with a smoking cessation program and quit for good to protect your bones. Many health problems can impair calcium metabolism and cause your bones to become weak and possibly break. Damage can be directly caused by a condition, indirectly caused by a condition's treatment, or caused by a combination of both. Some disorders are linked to bone loss and osteoporosis for reasons not fully understood. Muscles get weak if we don't use them. Bones are the same. Our bones need stress that comes from moving, lifting, or anything else that works against gravity, and bones suffer when we are inactive and weightless. Stroke or Parkinson's disease. When you walk, each step transfers impact energy to your skeleton. If you jump, your bones get an even bigger impact. These impacts mobilize bone to add mineral. Without energy transfers, bone mineral leaks away, leaving bones weak and breakable. Any condition that restricts the ability to walk causes rapid bone loss, particularly in leg bones that are no longer carrying our weight. Bed rest following an injury or surgery. If you have had an injury or surgery anytime in the past few years, you probably noticed that healthcare providers wanted you up and out of bed as quickly as possible. This is to prevent the bone loss that will result from bed rest. Calcium absorption goes down, causing bones to get weaker. Muscle weakness. Bed rest is even worse for your muscles. You can lose 20% of your muscle strength from just 1 week in bed. Weak muscles lead to weak, more easily broken bones. Smaller muscles exert less push and pull on the bones they are attached to, so they are unable to share the load when bones get overloaded. They also make it much more likely that if we trip, we will fall, and falls are the #1 cause of broken bones in older adults. Paralysis. People who use wheelchairs to get around can maintain strength in their arm and back bones through upper body exercise. However, the bones in the legs are much harder to preserve without loading. And last, fatigue disorders. Many conditions can cause periods of extreme fatigue. Chronic fatigue syndrome, anemia, sleep apnea, clinical depression, and many other conditions can make a person so tired that they can't get out of bed. Like muscle, bone responds to exercise to become stronger. It's important to talk with your healthcare provider about the risks and benefits of any medications you take and about how they may affect your bones, but do not stop any treatment or change the dose of your medication unless your healthcare provider says it's safe to do so. If you need to take a medication that causes bone loss, work with your healthcare provider to determine the lowest possible dose you can take to control your symptoms. The following medications may cause bone loss. Aluminum-containing antacids neutralize acid in the stomach to reduce acid reflux, heartburn, or indigestion. Anticoagulants are blood thinners that treat, prevent, and reduce the risk of blood clots breaking off and traveling to vital organs of the body, such as the heart, lungs, and brain, which can lead to life-threatening situations. Cancer chemotherapeutic drugs are used to target cancer cells at different parts of the cell cycle. Estrogen blockers reduce the amount of functioning estrogen in the body and may be used to treat the imbalance of testosterone to estrogen in both males and females. Glucocorticoids and steroids are synthetic steroids that reduce inflammation by suppressing the immune system response. Cancer drugs have been used to prevent and control rejection of organ transplants, and they have also been used to treat a variety of other conditions, including chronic hepatitis, ulcerative colitis, Crohn's disease, bronchial asthma, rheumatoid arthritis, psoriasis, and other chronic skin conditions. Proton pump inhibitors are used to help fight acid reflux. Selective serotonin reuptake inhibitors are the most commonly prescribed type of antidepressants that help treat several conditions, including depression, anxiety, and bulimia. They work by keeping certain chemical messengers active in your brain. And last, thyroid replacement hormones are man-made thyroid hormones that work to raise abnormally low levels of natural thyroid hormones in the body, often used to treat an underactive thyroid that is secreting little or no thyroid hormone. Given the wide range of medications that have osteoporosis as a side effect, it's important that you keep your dosage under control. If you do need these medications for a long time, consult your healthcare provider about how you can avoid any unhealthy side effects. Medications referred to as steroids, glucocorticoids, or corticosteroids can be life-saving treatments for some conditions. However, they can also cause bone loss, which may lead to osteoporosis. Steroids are much like certain hormones made by your own body. They are often prescribed to relieve inflammation. Healthcare providers prescribe them for many conditions, including rheumatoid arthritis, asthma, Crohn's disease, lupus, and allergies. They are also used along with other medications to treat cancer and autoimmune conditions and to support organ transplants. The two most common steroid medications are cortisone and prednisone. Taking steroid medication in pill form in certain doses for 3 or more months can increase the chance of bone loss and developing osteoporosis. So talk with your healthcare provider about taking the lowest dose for the shortest period of time for your condition. If you need to take a steroid medication longer, you should take steps to prevent bone loss, such as getting enough calcium and vitamin D, exercising, and not smoking. You may also want to ask your healthcare provider if you will need a bone density test. Large medical and osteoporosis associations around the United States agree that the best way to test for osteoporosis is a DEXA scan. This test evaluates the levels of bone density in various parts of your body. The DEXA scan is painless and gives very accurate readings and is more accurate than a standard X-ray and emits far less radiation. It takes less than 15 minutes. All females age 65 or older should have a bone mineral density screening. Males can also develop osteoporosis and should consider a screening at age 70 and older. Females who are younger than 65 years and past menopause should have a BMD screen if they have had a bone fracture because of fragile bones or have other risk factors for osteoporosis. The bone density is commonly measured at the heel, spine, hip, hand, and/or wrist. After your screening, talk with your healthcare provider about when you should be tested again. How often you should have your BMD measured depends on your age, the results of your previous DEXA scan, and your individual risk for fracture. While osteoporosis may not be noticeable until bones start breaking, it's possible to prevent rapid bone loss and help build strong bones. There are treatments available for osteoporosis, and the one you choose depends on what is causing the loss of bone. Also, healthcare providers will typically prescribe a medication that can stop bone from deteriorating so quickly while also activating bone growth. You may also receive supplements to help combat the issue that may be causing the bone loss, such as calcium deficiency or vitamin D deficiency or menopause due to the loss of that specific hormone, mainly estrogen. In these cases, your healthcare provider will tailor your prescription to the severity of mineral or hormone deficiency. In addition to treatment of bone density levels, there are some proactive steps you can take before levels get too low, or if they've reached the point where you need treatment. Here are some lifestyle steps you can take in order to fight bone loss. Introduce more protein into your diet through protein-rich foods or supplements. Exercise by increasing cardiovascular activities and lifting weights. Both of these help maintain healthy, strong bones. Lose or maintain a healthy weight to help put less stress on your bones. And last, reduce alcohol consumption if you consume alcohol regularly. Breaking a bone is a serious complication of osteoporosis, especially with older adults. Osteoporotic bone breaks are most likely to occur in the hip, spine, or wrist, but other bones can break too. In addition to causing permanent pain, osteoporosis causes some people to lose height. When osteoporosis affects vertebrae or the bones of the spine, it often leads to a stooped or hunched posture. Osteoporosis may also limit mobility, which often leads to feelings of isolation or depression. Additionally, 20 to almost 30% of senior adults who break a hip statistically die within 1 year from either complications related to the broken bone itself or the surgery to repair it. Approximately 25% require long-term nursing home care, often as a result of limited mobility. Did you know 14 million, or 1 in 4 Americans aged 65 and older, fall each year? Falls are the leading cause of fatal and non-fatal injuries among older adults. And statistically, falling once doubles the risk of falling again. First, talk openly with your healthcare provider about fall risks and prevention. Tell your provider right away if you fall, worry about falling, or feel unsteady. Have your healthcare provider or pharmacist review all of the medications you take, even over-the-counter drugs. Some medications or combinations can make you sleepy or dizzy and may cause you to fall. Lack of exercise or physical activity leads to weakness and increases your chances of falling. Exercise to improve your balance and strength so that your legs become stronger, lowering your chances of falling. Ask your healthcare provider about the best type of exercise program for you. Have your eyes and feet checked regularly. Check in with your eye care provider at least once per year for a vision screening to catch any eye conditions such as glaucoma or cataracts that can limit your vision and increase your chances of falling. Also, have your healthcare provider check your feet once a year and discuss proper footwear, especially if you are a diabetic. And last, consider making your home a safe place. We will review some home safety tips here shortly. You can take action to prevent osteoporosis and reduce the risks of falling. Eat a balanced diet rich in calcium. A few good sources include milk, cheese, canned sardines, if you like them, and yogurt. Eat foods high in vitamin D. Vitamin D helps the body absorb calcium and can be found in eggs, milk, and salmon. If needed, vitamin D supplements are an option to discuss with your healthcare provider. Get regular exercise and lift weights. Remember, weight-bearing exercises stimulate bone growth to increase bone strength. Exercising regularly also increases muscle strength and size, which helps to support bones and prevent injury. A physical therapist or exercise professional can help you develop a safe and appropriate exercise program if needed. Connect with your healthcare provider for more assistance. As mentioned before, don't smoke. Smoking reduces blood supply to bones and production of bone-producing cells. And limit alcohol. If you choose to drink alcohol, limit to 1 drink a day for women and 2 drinks for men. Those taking certain medications should avoid alcohol. Keep in mind that alcohol slows reflexes and may cause confusion, dizziness, or disorientation. Check for home safety. Go through your home and remove clutter and add handrails to reduce falls and accidents. And last, talk with your healthcare provider about a bone density test. Remember, this X-ray measures the amount of bone in specific areas of the body and helps determine risk for bone fractures. This screening could help to manage your bone loss and prevent those fractures. So here are some tips to make your home safer. So first and foremost, remember to wear appropriate shoes all of the time, both indoors and outside. People in a hurry need to slow down too, so accidents are more likely to happen when you do things in haste. First, we'll focus on rooms and stairs. You should work to improve the lighting in your home, fix steps and floors if needed, install handrails, anti-slip strips, and lights on all stairways, remove excess furniture, and remove things you can trip over, such as clutter, throw rugs, and electrical cords, just to name a few. Next, the kitchen. Install smoke and carbon monoxide alarms. Keep items you use often in cabinets you can reach easily, and avoid standing on stools. If you need to stand on stools, purchase a stool that has a hand grip that you can hold on to if you need one. Next, bedrooms. Make lighting easy to turn on and off at the bedside. Ensure a telephone is accessible bedside, either a landline or a mobile phone. Add bed risers if the bed is too low, and plug in night lights for visibility during the nighttime hours. And last, bathrooms. Have grab bars installed next to and inside the tub and the toilet. Use non-slip mats in the bathtub and on shower floors, and if needed, install a raised toilet seat. It's important to take care of your health. Don't forget to have your vision and hearing checked. Review your medications with your healthcare provider and/or pharmacist, and remember to stay active and exercise to build both muscle and bone strength. So in summary, you can prevent osteoporosis and strengthen your bones in the following ways: exercise and physical activity. Remember, workouts can boost your bone health. Calcium and vitamin D. Eat high calcium and vitamin D foods to support the minerals within your bones. Vitamins and supplements. Consider taking vitamins and supplements at the direction of your healthcare provider. And last, avoid smoking and drinking. Here are the SummaCare resources that we offer. We definitely encourage an annual visit with your primary care provider. We do offer condition and care management programs to help you if you're diagnosed with a chronic condition or have any complex needs. We do have access to diabetic testing supplies. We do offer telephonic health coaching for lifestyle behavior management goals. You do have access to WebMD Health Manager through our Plan Central. You do have access to our 24-hour nurse line. Our SummaCare nurses through Summa Health are available 24/7, 365 to help you with any medical questions you may have. You may have access to Teladoc Health, which is a telemedicine feature while traveling or in need of minor medical issues or concerns. We do offer a smoking cessation program called Quit Care. It is a telephonic coaching program, and we do offer limited nicotine replacement therapy as support. And last but not least, Husk Health and Wellness discounts. You do have access to discounted health club memberships, nutrition programs, and educational resources. To ensure you have these programs through SummaCare, please refer to your schedule of benefits. Thank you for your time, and definitely be well. Here are the resources that were used to create this presentation. And we encourage you and invite you to follow SummaCare on any of the social media platforms listed below. Thank you.